Good afternoon, everyone just joining us. All right, we'll give everybody a minute to get settled and get into the webinar, and then we'll kick things off. All right, see lots of folks joining. We'll just give it another minute. I just feel like there should be intro music. Maybe next time we'll get something fun going.
That's a good idea. I like that.
I love intro music. Okay, perfect. I think we'll go ahead and get started. We want to make sure that we're cognizant of time and save lots of opportunities for Q&A, which we do encourage. So let me start off by saying welcome everyone to another MassMedic webinar. And I have to say a huge shout out to Sunrise Labs for suggesting this amazing topic. So I'm Rachel Robinson. I'm the Chief Operating Officer at MassMedic, and it's absolutely my pleasure to be here with you today. So a few quick housekeeping notes before I turn things over to Nick for this webinar. We do encourage questions. There is a Q&A option at the bottom of your screen for most of you. Sometimes it's on the side. If you submit your questions there, you can submit them throughout the presentation and we'll do Q&A at the end. And I'll make sure that those questions come in and that Nick can see them. And then if you would like to, we will be sending out the recording of this webinar after the program so that you can access this and be able to watch it at your own time. But we really are thrilled to have you joining us here today. So that's really just the quick housekeeping notes. I think everybody knows how Zoom works at this point, but we're here on chat. If you need anything, you can always reach out. But I'm going to go ahead and turn things over to you, Nick.
Thank you. Okay, well, I'll get started then. So I'm Nick Lesniewski-Loss. I guess I probably should put my name in the slide here. I am the Senior Director of Systems and Software at Sunrise Labs. For those who don't know me yet, my background is quite varied, highly technical, deep in electrical and software engineering, a lot of connected devices over the last 15 years, and medical in the last 15 years, and before that, non-medical, but a lot of connected device experience. So I'm coming from a very technical space. I've done webinars on this sort of topic before, in fact, relating to connectivity, usually with a focus on Bluetooth or very specific aspects there. This one, with my engineering background, I tend to be very fact-based and very everything's quantified and modeled. This one's going to be a little bit less quantified. This is more experiential. This is things I've seen and notes based on a lot of discussions that I've had with our clients and our prospective clients. They'll still be facts, I hope, and hopefully some useful tidbits of experience for you to build off of. So, what am I going to cover today? I'm going to cover some wireless communications technologies, and why you might pick one over the other. I'm going to talk a bit about, what makes medical devices different from consumer devices, which may seem obvious to people, and maybe it is obvious to everyone, but I don't get the impression that it is based on conversations that I have with other people. So I want to give my perspective on that. And then, the term user experience comes up a bunch here. I'm not talking about UX in the sort of UI sort of frame. I mean that in the sense of how users actually experience your whole product. It's not just about the software. It's not just about the UI. It's about their total experience with it, which many people will take user experience to mean that. Some people tend to view it as more of a software-centric term. And so that's what I hope to cover during this. So just jumping right into it, there are a lot of wireless connectivity protocols out there to choose from. This is not an exhaustive set of logos, but it's a pretty reasonable representation. I will say I'm focusing mostly on the sort of IoT aspect of MedTech. So that's where you see a lot of these sort of device level communications. And I would say that they tend to split into two bulk categories of device or of target application space. You have the networked computer kind of model where your device looks just like a PC. It looks like a computer. It talks over a network. It has an operating system, a full operating system. It's running Linux or it's running Windows, and it's interacting at that sort of application level. And then there's the sort of edge device model. Those terms aren't set in stone. You know, people use those terms and other terms, to mean different things. But what I mean is a network computer model is a model where your device looks like a networked computer, looks like a PC, acts like a PC, talks to other devices on the network like a PC. And when I say edge device model, I mean more like a wearable device, a small device that's running with maybe a microcontroller with a constrained resource footprint, probably has some battery constraints. It may not, I think that model also works for benchtop equipment and even laboratory equipment. Freestanding laboratory equipment, manufacturing equipment can also fit into that model. But I think it's useful to distinguish between the two because the technologies that you might focus on are different based on what the norms within that model are, and so what is available to you to easily implement. So network computers are generally going to use Ethernet and Wi-Fi. That's pretty much it. They have Bluetooth and everything on them, but they're usually meant to be hosts for those rather than devices in those networks. And there's a lot of other people talk about those devices. I think that I've seen multiple other webinars about that kind of MedTech device, that kind of implementation. So I'm going to focus more on the smaller microcontroller type edge device type devices in the rest of this talk. And to that end, most of these protocols are applicable in some way, shape, or form to those types of devices. Some of them are lower level protocols. Some of them are higher level protocols. Things like Matter is actually an aggregate that runs on top of Thread or Wi-Fi or Bluetooth LE. CSA is the new Zigbee, but it's an umbrella category that includes a bunch of other things. Amazon Sidewalk is built on Bluetooth LE and Zigbee and one of the 802.15.4 type protocols. So there's a lot of overlap between these as well. And there's a constant evolution of these protocols. Some of these are new, some of these are old. Some of these are so old. I didn't include some of the protocols that were big news 10 years ago, like wireless USB, or 20 years ago maybe now, wireless USB, which is completely dead. No one ever used it. And so that wasn't worth mentioning. Ant is on here for people who know Ant. Ant is also essentially dead. I'm told that people still use it. I haven't seen an Ant device in a long time. Samsung was one of the bigger proponents of Ant as a protocol. It was meant to be a competitor to Bluetooth predominantly. And it was a great protocol. I liked using it. But even Samsung backed away from it and stopped supporting it in their phones about 5 years ago. I think it was somewhere in the 2020-ish timeframe. So those ones are, a little bit on the older side. Some of these are more out there. N-Ocean is one that was designed for devices that don't have a battery in them to harvest energy from actions. So its main use is light switches, actually. Z-Wave is a building automation. Matter and Thread tend to come into building automation type applications as well. LoRa is short for long range. That's one that doesn't come up an awful lot with medical devices. We've had a couple of projects that looked at it as a serious contender and didn't end up using it. The main reason is that with a medical device, there's an expectation usually that you have a patient and that the device needs to interact with the patient in order to be useful. And that isn't usually possible from long range. That's not unilaterally true, right? We could be talking about IVD type equipment or laboratory equipment that doesn't necessarily need to be next to a patient. But in general, when we look at wireless communications for medical devices, the idea that your device is so far away from you that LoRa looks appealing it's rare. It is rare. Some of these are, as I mentioned, are building automation focused, which seems like a strange thing to include in a list of technologies relevant to medical devices. We haven't seen a lot of those come through Sunrise. The topics have come up a number of times, but don't usually make it to the end device. I expect that might change in the future. There's certain use cases you could imagine that are medical devices that might make sense to integrate with a building automation type system, type infrastructure. Things like the classic, pill cases. I remember probably 15 years ago, somebody made a Bluetooth connected or Wi-Fi connected pill case. The idea is that it can give you information like how many pills are left in the bottle, or send you reminders to take your pills, or give you location information. Even some of these protocols support location finding, and so you could have the pill case potentially locate itself in your home and tell you where you can find it. There might be other use cases, dialysis machines, home dialysis machines, maybe. You might want to be hooked up to a home automation system. Emergency medications, EpiPens, another case that maybe you want to communicate their status to let you know whether they're expired, whether they've been used, etc. And so I expect that might come up more in the future. It's not terribly common now, and most of those run on protocols that are already used for other purposes like Bluetooth and Wi-Fi. The vast majority of applications that we look at in this space come down to a few protocols, and they're the ones that you would guess. You've got your Wi-Fi, you've got your Bluetooth, predominantly Bluetooth LE these days. You have your cell type protocols like LTE-M and NB-IoT. And then there's NFC is also pretty common, particularly in conjunction with Bluetooth devices for out-of-band pairing, but it's also used for other short-range communications. Also compatible with RFID there is very helpful in some types of equipment. So that was a lot, but we'll pare it down to the ones that are most interesting, I think, in this application space. And this is a simplified version of a chart that we've used in a number of projects to guide decision making toward one protocol or another. It's really important to consider that the specific requirements of your application to understand which of these is even applicable. It's not usually a matter of which is the best and they could all work. Usually you have use cases that really push you towards one or the other. So this is a chart that might surface look like a normal sort of decision matrix or a Pew chart, but it's not really, because it's not that these are not necessarily directly comparable options. They are options that have comparable specifications, but if, for example, you need more data throughput than you can get through Bluetooth LE, then it's not an option. It's not that it's just a slightly worse option. It may just not be an option. So that's a little bit different than your normal decision matrix. So an LTE-M and NB-IoT are treated separately. They hit different use cases. I think people refer to them often as the same thing. The hardware is often interchangeable, so there are devices that support both. The use model is different. The bandwidth is different. The data throughput is different, and the signal integrity is different. NB-IoT is a little bit more tolerant of longer distances and worse connection quality and more congested networks, but you have less bandwidth as a result, less data throughput. I specifically refer to data throughput here rather than bandwidth, and I put numbers there that if you are familiar with the protocols, you may think are wrong, right? So Bluetooth, you might immediately say, well, no, that's 2 megabits, right? There's a 2 megabit PHY for Bluetooth LE, but that's not the data throughput that you get through Bluetooth LE. In a normal application, you don't want to count on getting more than 100 kilobits a second through Bluetooth LE. There are ways you can use the isochronous mode that came out in Bluetooth 5.2 a few years ago that was designed for LE audio, but that's a much bigger pain to use than the more standard gap-based LE mechanism. And even then, it's not going to get you 2 megabits per second. You might get 400 kilobits a second through that with a non-guaranteed delivery, which is one of the advantages to Bluetooth, is that you get guaranteed delivery of your data. Excuse me. So the factors that go into this are written here, right? So internet protocol, so IP. An interesting aspect of Bluetooth LE and NFC is that they really don't have a mechanism for doing this. There is a standard profile for Bluetooth that implements an IPv6 layer. So there is hypothetically a standard way of connecting Bluetooth devices to the internet. I've never seen it implemented. I've not seen it in any Wi-Fi routers or devices. I've never seen it implemented. Maybe I'm just missing it, but I don't think it's used. So it really isn't a use case. If you want to connect your device to the internet, to a cloud server, you can't do it directly from Bluetooth LE. You have to do it with an intermediate, usually the user's cell phone. If your ecosystem doesn't have that intermediate device, then that's not an option. You can't use it. You have to choose a protocol that does, like Wi-Fi or one of the LTE types. You might need, there's another advantage to Wi-Fi, which is that it's not just that it can access the internet, it can access the intranet as well, making it pretty much the best wireless choice for an HL7 integration. Because if you can get on the hospital's network, then you can access whatever LLP, FHIR type interface is available there. You may not be able to do that with one of the LTE type protocols because those interfaces may not be exposed to outside of the hospital's network. So that Wi-Fi is really the only choice in that case for wireless, or of course you always have Ethernet for a wired connection. Excuse me. Why do LTE and NB-IoT come up at all is probably a reasonable question. And it's a little bit less common than it used to be. A few years ago, we saw a lot more interest in these cell modem type connections. And the main reason was because of the challenge of getting devices connected to hospital networks or clinic networks or users networks, right? If you use Wi-Fi or Ethernet for that matter, you have to get permission from the local IT department or from the user to hook up to their network in order to have a chance at accessing your cloud service, your network service. If your device relies on that network service for data collection, for pushing updates, for managing the user's account, then you can bypass all of that by putting a cell modem on it. And that was a really big deal a few years ago. I've heard a little bit less about it. I'm a little bit less close to hospitals than I used to be about 10 years ago. And so I don't know from firsthand, but I hear from secondhand accounts now that it's a little bit easier these days to get onto hospital networks. There's, of course, still cybersecurity concerns, but people have amped up their cybersecurity policies on the device side. And so it's generally a little bit easier to get onto those networks, which would push the pressure down, I think, on the LTE type implementations. The LTE type implementations tend to be the most expensive. They're tens of dollars versus single-digit dollars or cents. Some Bluetooth applications, you might be looking at 50 cents worth of equipment. We've built into inhalers and small wearable devices, things that, the sale price of the device is in the dollars. And it can tolerate Bluetooth from a cost standpoint, but it would never tolerate an LTE modem. So this is a chart that maybe will help someone with thinking about their options when they have options. The point about roaming is not so much about cell roaming, like not from one service to another, though that does matter. It's more about whether or not you can move the device around and still maintain your connection. Wi-Fi can do this. There are Wi-Fi mesh networks and things that can do this quite well, even between networks, but they're not that common. Usually you have to have very explicit access to the local network in order to have access outside that network or within that network in order to do any kind of communications. And so it's not great. Bluetooth is generally pretty good as long as it's something like a wearable device or an implant or something where you're talking to, or where you know that you have your intermediate device, your smartphone or computer or whatever it's talking to nearby, base station nearby. And then as long as you're always within range of that, like if the device is a worn device and the user keeps their cell phone on them, then you can roam anywhere and it will still keep talking to that cell phone. So it actually works out pretty well. PAN is short for a personal area network in this case. So that's the roaming model there. NB-IoT, I listed as poor here. That's actually old information. NB-IoT is much better than it used to be. It used to be pretty bad from a roaming standpoint. It required some re-authentication every time you want to change which cell tower you were talking to. That's not really the case anymore. It's pretty seamless. It has a little bit of a longer lag in the changeover than it used to, than LTE-M does, but it's pretty good these days. I should probably update this table as a result. So I think that's enough I want to say about that table. So I've talked a lot about technologies so far, but technologies are really the easy part. And this is this was really the impetus for this talk to begin with, was we get a lot of clients in here and prospective clients in here, and they always have this view that everyone has, that Bluetooth is easy, Wi-Fi is easy. Every device supports these things. It can't be that difficult. There's all these libraries available. There's all these devices available. They're cheap. They're plentiful. You can get set up really, really quickly. And that's all true. I completely agree. The technology is very, very easy. However, making it work for users and making it good is really hard. It's really easy to make a bad connected device. It's hard to make a good connected device. And that I think needs a lot more attention than people give it, right? If you just take a person, tell them to put Bluetooth into an inhaler, for example, the result is going to be poor. It's going to end up with users never using the Bluetooth because it's too much of a pain. In fact, this is true of many medical devices that have Bluetooth enabled. People don't ever use it, and not just medical devices, consumer devices as well. They don't use the Bluetooth. They don't use the connectivity. They don't attach it to their Wi-Fi network because it's more of a pain to do that than to not do it. They don't see the benefit. A lot of this comes down to managing, excuse me, managing the user's understanding of what the device is doing and should be doing. A lot of wireless devices, particularly when we look at the Bluetooth type devices, are small devices. They may not have a display or a screen on them. They may have limited buttons on them or limited indicators on them. It can be really difficult to communicate to the user what's going on, what it's trying to do, whether it's communicating. And when things don't go perfectly, or they take more than a couple of seconds for an action to result in a response, users can get confused and frustrated with the device very, very easily. Users are left guessing what their device is doing. And why that's important really comes down to, I think, this idea of correlating confidence or correlated confidence. And I'm not sure that's a technical term. It's just a term I tend to use. The point is, when you use a device, medical device or otherwise, and the aspect you interact with is clumsy and doesn't work well, then you lose confidence in its ability to do its other things well, to make to perform its other functions well. And this is really hard for developers to see and to understand. Most engineers working on devices are focused on the critical functions of that device. We've got medical devices. You might have an insulin pump, right? And you want to make sure that it's pumping that insulin, it's delivering insulin exactly as much as it says at the rate it says it's delivering. Its monitoring systems are working correctly, and it's safe to use. That's the critical primary function of the device, and the one you're going to spend all your time trying to make work right. But if you do that and you spend no time making the Bluetooth functionality work right, and the user's interaction with the device is through Bluetooth, and they're constantly futzing with it and pressing the buttons to get it to repair, and it's giving them stale data on their phone, or they don't even know if it's talking to their phone because the state information isn't well presented, then what confidence do they have that it's doing its job of delivering insulin correctly? They don't have great confidence in it. It erodes user confidence, and it makes them less likely to use your device, which is not good. You want them to use your device not just for financial reasons, but because your device exists presumably to help people who are in need of some kind of medical help. So they correlate their confidence in the important features with their confidence in the unimportant features. And the unimportant features are ironically usually the ones that are most visible. Connectivity is front and center. A person's ability to get their phone and their device to talk together is front and center to their interaction with their device. And if that doesn't work well and seamlessly and instill confidence, then your device is not going to get good adoption. And so that's the developer bias there that I'm talking about, is about focusing on those critical functions and ignoring the functions that are critical to the user experience, but not to the medical function, to the therapeutic function of the device. So the next concept is sort of the engineering blinders, which is a related concept for those who may not be familiar with what we mean by blinder, what the term blinders refers to. It refers to horses, and there are these blinders, these flaps that you put over the sides of the horse's eyes to restrict their peripheral vision so that they can only focus on what's directly ahead of them, which is where you want them to go, right? So you have a team of horses pulling a cart. You want them to go directly forward. You don't want them to get distracted. You don't want them to get spooked by something coming up, aside them. So you literally put blinders on them. You put these flaps over their eyes so that they can only see directly ahead and ignore everything else around them. And engineers do this all the time. When you build a device, when you're working on a device, you're constantly testing it. We view test as a sort of separate function from engineering, but what engineer writes a piece of code or designs a circuit and doesn't immediately get on the bench and prove to themselves that it works the way they think it will work? Of course they do. We're testing constantly. However, we're always so laser focused on testing that functionality that we just implemented that we ignore all of the other functionality that we had to get through to get to that. And what I mean by that is, if you have a device, an insulin pump, and you're making a change to how it pumps insulin, you want to go test that change. You basically do whatever you can to bypass the workflows, to get you to the point of being able to test that. If you come across a workflow, if you come across an issue with pairing, or the device doesn't show up on the devices list, or you can't remember exactly how to access the feature you want, and so you have to think about it or go look up the directions, that's an interruption. That's something you should pay attention to, but you don't. You completely forget. You forget it immediately. It goes out of your mind as soon as you get past it. You may at best think, oh, that's not ideal. We should deal with that later. And you completely forget about it. You go and you test your feature and you move on. You put those blinders on and you ignore everything else. And that is important to an extent. You do want to focus on what you're trying to test. But it's also important to realize that the user is going to go through those same problems, going to have the same issues, the same interactions. And it's really, really helpful to recognize that and capture that, excuse me, when it happens. So let's see. So the last point I hear about, the more intuitive the workflow, the more work went into it. So I put a couple of eye charts down here. There's an app. This actually, the one on the right didn't have a device associated with it. The portion on the left did. These are two separate products. But the point is about when the workflow looks really slick and works really well, and users can operate the device or the app, can work through it without asking a lot of questions because it's intuitive, that usually means an awful lot of work went into it. The eye chart on the left there is a 99-page document that only describes a portion of the workflows for a device that has two buttons on it, I think, and no display. It was a Bluetooth connected device. But there are so many ways in which the user can interact with that device, not just the one intended way, but a million other ways that were identified, that it was really important for us to clarify all of those and work through them and come up with solutions that, regardless of what happened and how the user tried to interact with it, it was clear to them what was going on and how it was working. I'm not going to suggest that every product needs 100 pages of workflow for just the UI presentation for a device. Some may need far less, some may need far more. I'm really not worried about the number of pages. The point I wanted to get across is that people who are using that device will never know how much work went into making it so convenient to use. In fact, if we do our job right, they'll think it was just trivial and obvious, right? It was just obviously this is how it should work. This must be easy, right? It's not. The easier something ends up being to use, the more work it took to get there usually. And that's important to remember when you're trying to scope out projects and trying to understand what you need to do to get your device to be usable and to the point that people want to use it. All right, let's move on. So, up till now in the presentation, I've mentioned medical devices a lot, but nothing I've really talked about is specific to medical devices. All of those ideas really apply to consumer devices as well. And I think it's worth asking and continuing to revisit the question of, is there really a difference? Do we really need to consider this different because it's a medical device? What makes a medical device different from a consumer device? And I hear a lot of very different opinions about this from people. Some people will come from the standpoint that any software engineer in their parents' basement can make an app and can make a Bluetooth device. So it's not a big deal. Why should it be a big deal for a medical device? It's what makes that different? And some people will come from the exact opposite standpoint and will say, "Oh, it's a medical device. You've got this overbearing process requirements, and the FDA has very high expectations and requirements, and it's a really big deal and adds millions of dollars to any effort." And I think both of those are somewhat sloppy thinking. There are requirements, of course, set by regulations, but they're really meant to set a minimum bar based on the understanding that the main difference between a medical device and a consumer device is that there is an intrinsic risk of harm to any medical device. The medical device is interacting with a patient either directly or indirectly. Might be analyzing their blood, or might be a wearable device, would be a spinal cord stimulator. And regardless, there is a patient involved, and that patient is more vulnerable than some consumers, and is in need of some kind of intervention. And that's what the device is meant to provide. And so at the very least, you have a risk of harm in that if it can no longer provide the intervention necessary, then the person does not get their medical intervention. That's a sort of extreme end of what the risks might be for a medical device. But the point is that there are categories of consumer devices that have no risk of harm or introduce no risk of harm to the user. But every medical device has some intrinsic risk of harm to one of the users. And that, I think, is the important to remember as the main difference. And to that end, the FDA's requirements are really just meant to set a baseline. They're not meant to say this is every medical device must be the most well-designed, developed, highest quality device ever. I mean, there isn't money to do what Apple does for iPhones for most medical devices. Apple spends more developing their iPhones than I think the entire medical device industry combined has to spend on devices. It's their processes. Talk about overbearing processes. Their processes, in order to maintain their brand, are huge. They've got huge brand risk there that they're trying to mitigate. We are trying to mitigate risk of harm to patients. Oh, excuse me. And So, I think that's a useful way to think about it. And it's useful to remember that that is a minimum bar. You really want to do more. You want to design these devices well because you want your devices to be good. I'm not saying you should want to spend $10 billion in every device. Maybe you want to. You have to be realistic about what the market can bear. But anyone who says, well, I can get anyone to design an app in their parents' basement is really not taking seriously the fact that when you're talking about designing a medical device and an app for a medical device, you are introducing a risk of harm, and you're by being so sloppy in your controls of that, you are creating an unnecessary risk of harm that you could have easily mitigated. So, vulnerability of users, I talked about that a bit. Ultimately, managing those risks does add some burden relative to not managing risks, relative to ignoring risks entirely. I don't think it's as much as people usually think, though, right? It's good design practices, tools that have existed for a long time and that you're going to use anyway for other reasons, right? You might use an FMEA for one form of hazard analysis, you might use a fault tree analysis for another. And you probably want to do that for reliability reasons anyway, to evaluate where your device is going to fail and to make sure you're designing a good, solid device that doesn't break down on consumers or the users and that they want to use. It's not a huge lift to also add in risk of harm in that. In fact, you really do that anyway, regardless of whether your device is a consumer device or a medical device. So it's really, I don't think there's as big of a gap there as people tend to think. There's a gap, but I don't think it's as big as people think. The main gap there is in the record keeping and reporting aspect of it. You don't just have to convince yourself; you have to be able to convince other people who are not part of your organization that you've done, a good job there. And that's the additional burden that's placed on medical devices from that standpoint. But really, I think user expectations are often underestimated, and the effect that user expectations have here is underestimated. It's true of consumer devices as well as medical devices, but the difference, I think, is that users will tolerate a lot more from consumer devices than from their medical devices, right? You think about like a Bluetooth mouse, for example, that you've paired to your computer. Every once in a while, you pair a different mouse to your computer, or you pair that mouse to a different computer, or it just forgets the bond record. And every once in a while, you have to repair it to your computer. You go through a little workflow in Windows or Mac OS and tell it to find the devices, and you press the button on your mouse and it connects, and you're fine. No big deal, right? In fact, you may not even remember doing it. You may not notice that you do it because it's barely an inconvenience. But now imagine doing that for a device in a clinic. It might be a surgical tool, probably not with Bluetooth, but it might be a tool that's collecting data from a user, or is a stimulator. Is somehow providing a therapy or a measurement of the user. And in the middle of trying to use it, or even before trying to use it, you're futzing with the buttons and trying to get it to connect to the computer. It's not something that inspires confidence. It's not something that you want to do. You're not going to return your mouse if you have to press the button to repair it to your computer. If you have to repair your medical device to your computer, particularly in a setting like a clinic, and you've lost confidence that it's working right because you can't find it in your device list or something, you might return it. You might never use it. You might say this is a disaster. These things happen quite regularly. The expectations on how seamless a medical device works and how well it works and how high quality it is higher generally than consumer devices. So just a quick tip here that I would say is worry less about whether your device is a medical device or a consumer device. Use your empathy to put yourself in your customer's shoes and think about how you would see the device when you view it. Would you view it as something that is safe, something that is good? Would you be frustrated by the quality? Would you be frustrated by your interactions with it? Take a step back from thinking about how great its clinical function is and think about how the user is going to actually perceive it. Because I think that will help a lot in preventing issues due to user acceptance. And just one last point about that, because I've got the picture up here of this Encarta driver. I didn't talk about it at all. But when you put yourself in your customer's shoes, it's important to understand that not everything is about eliminating risks, right? So it's not, it's very easy to say that it's a medical device. It can have no risks. We must mitigate all risks as far as is possible, right? There's terms around it, but the terms are always nuanced. And the reason they're nuanced is because you have to take into account the use mode in that. Uh, it's very easy for an engineer to say, I'm not willing to accept that a user could be harmed by a device I designed. So, and or I don't think the FDA is going to accept it, or the industry is going to accept it. So I must make this completely indestructible, bulletproof, infallible, right? And you can imagine that with this device that's being shown here is a driver for a total artificial heart that we worked on. It's called a Freedom driver. And they already have an indestructible version of it. They have it. It sits on a cart. It weighs a couple 100 pounds. It's bulletproof. It just works all the time. Great. Except it's on a cart. The person who's using it is limited to a bed or a chair. They can't really move around. They don't have a heart, so it's difficult for them to wheel around a couple 100 pound device. And so it may be as safe, as risk averse as you can get for a device in that space, but the users don't want to use it. They've sacrificed their lives essentially to use it, because now they can do nothing but sit in a chair or lay in a bed. They want to trade off some risk for the mobility that the portable driver gives them. It can't have as much redundancy as the bigger cart mounted unit has. It can't have a wall connection all the time, because you have to be able to walk around with it. It has to have a higher risk profile by virtue of how it's used and what the customers need for it. And that's important to keep in mind. We're all risk averse in the medical space. We have to be. We want to avoid harming people. But if we design a device that's incapable of harming a person, but it's also incapable of helping them, that's not really a win. Classic example there would be a scalpel, right? You can make a scalpel that will never cut anyone. What good is it as a scalpel? So moving on. So just some tidbits about things I've picked up. I talked about this a little bit before, some of these things. What should you be thinking about when you design your devices? I think first and foremost, you need to understand your user groups. And I define that a little bit more broadly than most people. If you go into a usability study or something, they'll talk about a few of the use groups. They'll talk about patients, talk about clinicians, nurses, caregivers often, right? You might have parents of young children, or you might have children of elderly parents. And that's all good. They're extremely important, of course. I tend to expand my view there to include developers, device developers, right? It seems a bit strange. They're not an end user of the device. But developing a device takes a lot of work. How long it takes you to iterate on a design can greatly affect your overall progress, your overall project success, how long it takes you to get to the finish line, and how good the project is at the end. So designing your device so that it is designable is actually really important. Researchers is also a potential user group, even for devices that are not meant to be research devices. Nowadays, pretty much everything, particularly when we talk about connectivity, pretty much everything is cloud connected. There's some back end somewhere collecting data. And one of the main goals of that is that you can mine that data for a better understanding of how your devices are used, how they fail. And so, there's researchers may be interested, quality people may be interested, developers may be interested in that, may interact with that data. Service, of course, there's service personnel. If someone has to get out there and exchange parts or their returns, and they have to exchange parts, that's important. Manufacturing techs, right? So people on the manufacturing floor who need to program the device, assemble the device, that these are all things that are worth considering during the design. People who are all worth considering their perspective of it. So picking the right technologies for the use case is pretty easy in general, right? I think it generally pairs down to whether when we talk about communications, right? What of the set of really available technologies meets my needs. And if it's none of the above, then it becomes hard, right? If you need something with far higher bandwidth than you can possibly get with a common technology, far lower latency than a common technology, that might be difficult. There are reasons it can be difficult, but in general, it's pretty easy to pick the right technology. You figure it out from the use case. If it's a device and you're just replacing a USB cable, essentially, Bluetooth, that's what Bluetooth was designed for, right? That's an obvious use case. If you need something to be a set-top box that has high bandwidth to a data collection server, an HL7 server, something like that, then Wi-Fi, Ethernet, pretty straightforward. Understand the desired workflows. That's difficult. There's the happy path or the happy paths. There's when everything is working correctly, you have an expectation of how the user is going to interact with your device. When everything is going correctly and they understand how to interact with it, and that's not so bad. But what really ends up happening is that there are thousands of corner cases, maybe not thousands, but there's lots of corner cases. There's lots of unhappy paths that you need to be able to predict and guide users through, because it will happen. Particularly when you're talking about wireless connectivity, there's always going to be connectivity issues. There will always be environmental issues that come up. You cannot make it bulletproof. So much work gets put into making the protocols resistant to interference. And that's great, but you still have to expect that at some point you're going to lose a connection or you're going to lose packets and have to retry, things like that. You have to figure out what to do in those cases. And that's the device workflows. Actually, with the user, there's a whole bunch of other workflow issues. You have to expect that someone's going to just use the device in a way that you never predicted. That's kind of crazy sometimes. That they don't understand how to use the device. That's not clear to them how to use the device, even if you think you've made it abundantly clear. And it's helpful to try to predict that. You'll never predict it all. You'll miss some. It will happen. Oh, excuse me. So let's see what's the next one here. There's running through every conceivable unhappy path scenario. Yeah, like I said, you'll never get them all, but get as much as you want. It helps to have people on your team who are good at finding those corner cases because they're observant. They are unbiased, or they're able to take themselves out of their bias, and they have a good practice of capturing deviations from their expectations and the expectations that were deviated as they go. And I think that's a useful tip for everyone to think about, is that when you find a person like that, it's great and it looks very natural, but it is something that can be trained. That is a skill that you can absolutely teach, can absolutely learn. It comes down to recognizing and forcing yourself to recognize when you have an expectation that wasn't met, and then forcing yourself to write it down immediately. Nowadays, I recommend, pretty much everyone uses Jira. I recommend just creating a Jira ticket, throwing in your backlog or putting it up for review to get into the backlog every time it happens. And don't worry about if it happened 3 times, about saying, oh, that already happened twice, I'm not going to add another ticket for it. Just add it. Keep a consistent policy of every time you come up with a missed expectation or something didn't look exactly like you expected, capture it to discuss in the future with other people. It will help teach them about what your expectations were and how the device didn't meet that. And it will help you guys work together to make a smoother experience for the user. And I'm a little behind schedule here, so I'm going to move a little bit faster. Oh, managing state carefully. So state management and communication is so much harder than people think it is. Basically, you always want to pay attention to when you're practicing with your device, when you're using your device, when you're testing your device, always try to think to yourself, do I know what the device is doing? Do I know what state it's in? And am I right? Right. And so many times you'll find it's not, right? The device is doing something that you didn't expect it to, and you ignored it because you weren't testing that feature. But state management is often underestimated. All right, so last topic for this I'll touch on is cybersecurity because it's such a hot button topic. I can't get away from it. I can't avoid it. I feel like I use this quote in pretty much every presentation I give on these sorts of topics, usually for different reasons. This Jurassic Park quote of your scientists were so preoccupied with whether or not they could, they didn't stop to think if they should. I'm often questioning, not just in cybersecurity, in just about everything, about whether or not we should be doing what we are doing, or we're doing it just because it can be done. This happens a lot with novel technologies, novel ideas, novel concepts. Cybersecurity is novel to a lot of people. And so there's a lot of people advocating for and writing papers on policies that are more geared towards whether or not they can make something more secure, not whether or not they should. I'll talk about that a bit more in 1 second. But from a system engineering perspective, we've been talking about this. System engineers at Sunrise and elsewhere that I've worked, we've been talking about this sort of topic for decades now. This is not new to us. What is new is how everyone else is interpreting the situation. What everyone else's understanding of the right level of security and managing trade-offs there is. In fact, one of the challenges as a system engineer is we tend to recognize that everything has trade-offs. Everything is a trade-off. You don't get new features for free. And when I say for free, I'm not just talking about the financial cost of implementing them. There's the cost to the usability of the device. There's the cost to the long-term usability of the device, the longevity of the device as well, right? If you have a security policy that requires a device to be networked in order to authenticate a user, then you've cut out the possibility that anyone could get a benefit from your device without having it networked. And that may not be an option for people. Their network might be down. You may have just harmed people by adding a security block that maybe wasn't really warranted or necessary, right? There may not actually be any major risk to information leaking. You may not have any identifiable information on it. There may not be any controls that could be accessed from the internet, but you've now put this block on this device, this constraint on this device that has made it less useful and less able to help people. So it's rare that these things come for no cost to the device. And I think it's, as system engineers, we've for years been talking about how to manage the risks through the risk management process, how to weigh the benefits with the benefits risk analysis. And I think that's still really important to keep track of here and to keep in mind as you look at the cybersecurity of your devices. And I would say, take everything you read and hear online, including this, everything I'm saying today, with a grain of salt, right? People are talking from their experience, and experiences differ. There's surprisingly little quantified data about these things. There's a lot of loose statements that you hear. There's rumors, there's myths. I heard someone claim just a couple of days ago that Bluetooth devices don't even count as devices that fall under the FDA's guidance and requirements for cyber devices, because the second part of the definition of a cyber device is that it must be internet connected. I think internet connected or access the internet is the term they use, I think. And Bluetooth devices don't have an internet protocol implementation in general. There's no meaningful IP implementation. So it doesn't count, right? Well, no, there's a separate document that the FDA released, or maybe it's part of the appendix of the guidance, that they specifically clarify that any device that connects to a device that connects to a device that connects to the internet counts, right? This counts USB, this counts Bluetooth, this counts, and they even call out Bluetooth specifically and USB specifically. So no, absolutely counts. That's a myth. Don't believe it. You read things. I've read things, where people say, one of them said that they talked to a reviewer, and the reviewer said that they frequently issue NSEs due to cybersecurity deficiencies, but they didn't quantify anything. Often people will say things like often and frequently and so many, rather than giving you actual numbers. The actual rate of NSEs, as published by the FDA in 2024, was 3.5%. Whether you consider that frequent or not, I don't know. I don't know how many of those were for cybersecurity or for other reasons. It's not nothing. And maybe that one reviewer issued all of the NSEs related to cybersecurity. And so they were telling the truth from their perspective. But I don't see evidence of an epidemic of NSEs due to cybersecurity issues. Not that you shouldn't take it seriously. Cybersecurity is extremely important and very difficult to get right. But take everything you hear with a grain of salt. The last sort of myth that I've brought up a bunch of times with people is someone once told me, an expert in cybersecurity, this is a few years ago now, was advising a group on what they should do to lock down their Bluetooth device and the Bluetooth network. And he made a very bold statement to me that everything in Bluetooth has been hacked, everything in Bluetooth is broken. That is, I asked him to support that with evidence, and he couldn't. He said he'd get back to me, never did. It is not a true statement. And if you take that approach, you're going to cause more problems than you help, in my opinion. The assumption that Bluetooth is a completely insecure protocol, and so you must necessarily, if you have a medical device, put another layer of security on top of it, does not necessarily reduce your risk profile. In fact, you're taking a security system built into Bluetooth, the AES-128 with Diffie-Hellman system that's been available on every device since 5.0 in 2016, long time, and you're throwing all of that away, essentially. And that has had years of testing, of people looking at exploits, of people beating on. It's been relatively well tested and hardened over the years. Your custom protocol that you put on top of it has no testing, has no hardening, right? You may have more confidence in it because you have confidence in yourself, but I don't have as much confidence in you as I do in the millions of tests that have been done on millions of Bluetooth devices over the years. So it's not clear that that's a winning solution. And you need to take the risks associated with mitigating the perceived risks in addition to the original risks. Okay, so benefit risk analysis, I think I talked a little bit about. I think it's important, still important. Gotta keep it in mind. And I guess that my last tip before I'll stop here is related to this, is I think it's still really useful to consider risk management with system engineers. Hire some system engineers who've been doing this for 20 years and are used to weighing risks and benefits, are used to weighing hazards and identifying hazards and mitigating hazards. Because I think their perspective is useful here and addresses some of these issues. So I've talked a lot. I think I'm almost over time here. I did not leave as much time for questions as I'd hoped, but hopefully there's still a little bit of time.
No, no worries, Nick. So actually, you answered a lot of the questions that came in. So cybersecurity, I'm glad you really touched on that quite a bit. One thing I could share, and I wonder if you've seen this perspective as well. We've been working with a lot of hospital customers, obviously, and one of the heads of supply chain for hospital, Vermont Health System, made a statement and just told us, hey, if your product connects in any way to any other product, if you do not walk in the door with your cybersecurity plan, your product will never get purchased by our hospital. Because even if it's the best product in the world, the supply chain person cannot buy that product unless the IT folks sign off on that plan. So I'd be very curious if you're seeing kind of similar feedback when it comes to the customer end as well.
Yeah, so I haven't heard customers, be quite so demanding, but it doesn't surprise me with the hospitals because they have got a lot at stake, and hospitals have been the subject of a lot of the attacks in the last few years. So sometimes accidentally, like the German one was accidental, I believe. But that's a big concern for hospitals, and so they're right to be very concerned. And that shouldn't be a big barrier, right? Having a cybersecurity plan and addressing the risks shouldn't be that big of a deal. I think a lot of people go overboard because again, it comes down to that risk benefit analysis and how far you go. I think there's a sense that more is always better and more is not always better, right? It's all about balance. Not all about balance is important too, I would say.
No, I think that's really, I think that's a great way of putting it, because I think also what they were seeing is a point that you made about just some confusion over what actually is a connected device. You know, companies coming and say, "Oh no, I don't have a connected device. Does it have Bluetooth in it?" Yes. Well, then you have a connected device. So I think the points you made around that were very well
I mean,
understood.
it's an extension of something we've been dealing with for 20 years now with USB connections, right? It's the same kind of question. People would say, "Oh, I don't have a connected device. There's no, you know, it can't connect to the internet." Like, well, but there's a USB port and it's running Windows.
Right.
There are exploits that
Right.
you can exploit through that USB port that you may not be considering. So yeah, it's the same kind of idea that we've been dealing with for decades.
No. Well, we are right up on time. So I do want to say thank you, Nick, for a terrific presentation. That was a ton of information. I know my head's swimming. And to thank everyone for joining us for this webinar. We really appreciate your time. We will be sending out, like I said, the recording of the presentation so you can take a look. And thank you again to Nick and Sunrise Labs for suggesting a terrific topic.
Thanks for having me, and sorry I didn't leave more time for questions.
That's okay. Everyone have a wonderful rest of your afternoon, and we'll see you at another program in the future. Bye.